Good morning and welcome back to the Real Life Academy podcast. I am your host, Marcus Moore, and today we're going to be discussing one of the most controversial topics in the current political and socioeconomic climate. So stay tuned as we explore one of my favorite topics of debate, the old question, do I need a therapist? Right here on the Real Life Academy podcast. When we think about therapy, what comes to mind? More importantly, perhaps, how does therapy make us feel? 6 years ago, there was a study published in the National Library of Medicine by Dr. Michael Bernstein and Walter Brown. And what they did was they took 96 patients who suffered from lower back pain, and they randomly assigned them either 3 weeks of treatment with a normal medication or 3 weeks with an open-labeled placebo. Now, the people that were given the placebo were explicitly told that the drug contained no active ingredients. They let them know this, but they also told them that some of the people that took this placebo reportedly felt better after taking it. So what happened? Well, when the study concluded, the patients who received the open-label placebo claimed to have better movement, better health, and feel better overall, despite knowing that the pill had no active ingredients. And this was so effective that some of the patients at the end of the study even requested the placebo medication, asking for it to be added to their daily regimen. It's incredible, isn't it? Now, you might be jumping the gun right now, asking yourself, Marcus, is this you talking about therapy being a placebo? Well, perhaps, maybe just a little bit, but not exactly. So listen up because it's about to get really interesting. You see, we are hardwired to find meaning in what we do, who we are, where we're headed, right? The power of suggestion is a critical tool for all therapists and practitioners. After all, if you can't plant a seed in the mind of your patients or persuade them, right, to act in accordance with an established treatment plan, you're not going to be very effective at all as a therapist. Now, it's generally understood that if you want to be viewed as an expert in your field, or at the very least competent to practice, you need to be able to influence and persuade your patients. Now, this isn't to say that persuasion is a negative trait. In fact, persuasion is the one skill keeping the global economy moving forward. We use it in sales, negotiation, peace agreements, conflict management, etc. But with that said, there is a darker side to persuasion, and we call that manipulation. And the difference between the two, it's subtle, but it's very intentional. Let me explain. When we persuade, what we're doing is we're opening up the floor for dialogue and conversation. Okay, it's a concerted effort where two people decide what is acceptable for them and then what is acceptable together. And then, of course, what is not acceptable, right? It helps us communicate better and see the world from different points of view. However, when we manipulate, what we do is we cement an idea, and then we use the power of suggestion or force to coerce others to act in accordance with our own wishes, our own goals, our own desires, right? It's inherently selfish. So what does this have to do with therapy? Why does it matter? Why do you care? Well, the numbers are in, everyone. People are enrolling in online teletherapy in record numbers. The problem, however, is that according to the National Alliance on Mental Illness, the efficacy of mental health has been in perpetual decline, with more than 220,000 people reporting that it's just not working the way they had hoped. It's really interesting, isn't it? We have an industry that's projected to grow 24% over the next 7 years, faster than some of the most prominent industries across the nation, and yet more than half, 55% of adults, still have not received any treatment. 60% of young adults with depression get no treatment at all. And quite possibly, that might be a good thing. You see, more people are enrolling and less people are saying that it's helping. And this is where the initial argument comes into play. If therapy is really as effective as all these therapists, psychiatrists, and neurologists suggest, why are we seeing so many more mental health issues? And why are people that can get treatment refusing to continue with treatment? It's not that more people are graduating from therapy. Okay, that doesn't happen. It doesn't happen at all. It's not that therapists are held to a higher standard of academic excellence than they were 30 years ago. None of those metrics have changed to a significant degree. We've added things to the DSM, right? We've increased the barrier to entry, academically speaking, but they're not held to a higher standard of academic excellence. The reality is that there are nearly 200,000 licensed therapists in the United States. To put that number in perspective, okay, there are 19,485 incorporated cities in the U.S. That means we currently have 10 therapists for every city in the nation. And yet the mental health crisis is becoming worse and worse. Why is that? Well, I'm going to let you in on a little secret here in the field of mental health. But first, we have to kind of give a side note. So the United States of America operates on a free market capitalist system, right? We maximize profit and opportunity for everyone that lives here. So the reason people come from across the globe to live in America, the sky is the limit. Now, the other side of that sword shows us that in the absence of morality and experience, people will do whatever they need to skirt the law and regulations. And this happens when you have a labor pool of young, unseasoned, unqualified professionals entering to the field for the first time. Now, that doesn't mean that there's anything wrong with newcomers. We need new people in the field of psychology. The problem is that if we don't have enough older people teaching the newer people how to do things, we're going to kind of just go off the rails and figure it out as we go along. And as we've said in multiple other episodes, trying to figure things out as you go along doesn't work, right? And this is why the field of psychology is riddled with inconsistencies, okay, in terms of clinical diagnosis. You know, nearly 40% of all patients who are diagnosed with SMI, or serious mental illness, are found to be improperly diagnosed every year. And the number only doubles when it comes to schizoaffective disorder. How did we get to this point? Well, you see, companies and practices are financially incentivized to grow bigger and to do better, right, than other people in their field, often at the expense of their own clients or customers. And the field of psychology is no exception. We can see this with companies like Cerebral, right, who disclose the personal and confidential information of more than 3 million users this year to subcontractors and unauthorized agents. The secret to the field is that mental health professionals are financially and academically incentivized to keep you in therapy as long as possible. You see, the problem we see is that oftentimes the intake assessment that you complete, or I should say that the psychiatrist technically completes, or the physician, they utilize only a small snapshot of your current environment. They only see a little bit of the picture, where you are in that moment. And they use that information and that limited scope of information, along with their own clinical judgment, to create a diagnosis which will follow you throughout your entire adult life. Now, the reality is that more than 30% of the U.S. population experiences some form of diagnosable mental health issue. That means that there is no shortage of patients begging for someone to tell them who they are and what's wrong with them. Now, does this mean that the field of psychology is awash with evil villains preying on the insecurity of patients? You know, maybe to a certain degree in some cases, but in most cases, no, right? Generally speaking, no. They're not evil villains preying on the insecurity of patients. There are specific regulations, right? There are requirements that people have to accomplish just to become licensed in the state that you live in. The barrier to entry, it's relatively low, but the academic requirements are relatively high. So with that said, does this mean that in the event therapy actually cured you or made you better, would that be a direct conflict of interest between yourself and the therapist? Yes, it would, right? There's a reason the DSM exists. There is a reason it is so critical to the industry. We have APA guidelines on ethics, but there are very few check and balance systems that hold psychiatrists and physicians accountable for the diagnosis that they perform. These diagnoses, guys, are subjective. They're based on clinical judgment. So what may appear to be borderline personality disorder, right, to one psychiatrist, can be reassessed and re-diagnosed as bipolar class 2 by another based on their observations and judgment. So what happens is that oftentimes patients will be treated for a certain condition for many years, maybe even decades, only to be re-diagnosed by another practitioner and prescribed a brand new regimen of medication based on that newly found diagnosis. And so the outcome of this is a cocktail of hormonal inhibitors that change the biological response to the outside world. They can alter your metabolism, stress response, the way your body processes glucose. fats, protein, etc. Okay? These aren't simple medications that work alongside your immune system like amoxicillin, okay? These medications effectively change the way that your brain and organs function, and with repeated use, the neural pathways in the brain become ever more reliant on these chemical and hormonal inhibitors to function correctly. So the big question that we all want to know is, should I be in therapy? I think that's the wrong question. I think the big question is, am I capable of suppressing intrusive or obsessive thoughts and impulses on my own? And if the answer for that is like everyone else, it's probably a resounding no, okay, because of the human condition. I think the second question is really the most important. And that is, when I struggle to suppress those, intrusive or obsessive thoughts, what tools do I have? And if the only tools you believe you have on hand are medication, right, and a weekly dump session with your therapist, I would say you're selling yourself short. The problem with therapy is that the only information that a therapist has to assess your issue is a snapshot of anecdotal testimony and your previous record. So unless you're an expert at communication, okay, and you're giving them constant updates and new information, they're going to keep giving you the same answers they've been giving you, which is going to keep you in the cycle until you have that light bulb moment. That's not a solution. You understand that. The other issue here is that once they create a treatment plan for you, it's up to you to follow that treatment plan. They can be there for support, but if you're already experiencing issues with your mental health, you might find it difficult to follow a daily schedule or implement new skills or try new things, right? And unless you're lucky enough to have someone around you to enforce that treatment plan in a way that works for you, that's effective for you, unless you have someone around you to help you with that, you're inevitably going to try your best, okay? You're going to fail. You're going to end back up in therapy a week or two later, and you're going to say, I tried it out, and I felt like I was making some good baby steps, but I just don't feel like I'm getting the hang of it. I don't know what's wrong, but it's just not working for me. Let's try something else, right? And then you go to the next thing, and the next thing, and the next thing. Look, it doesn't have to be this way. What you need is someone who's going to hold you accountable and give you a realistic roadmap, someone who understands you intimately and checks in with you consistently to make sure you're on the right path. A path to healing, not just living life in an endless loop, but actually fixing your issue and learning the skills to overcome those obstacles. And that's exactly what we are here to do. Real life coaches, I can't speak for anybody else. I don't even know any other company that does what we do. But our coaches, they work with you hand in hand to address those underlying causes that are driving the problems in your personal life. They help you identify those areas of opportunity, and then they give you the tools and resources to actually overcome the pitfalls. So if you're ready to make that change, take that step, head over to reallifeacademy.com today, reach out to our team. Let us know who you're working with. Give us the name of your therapist and their phone number. Give us their email. That way we can reach out to them. Go to therapy. Talk with your therapist. Ask them if a real life assessment is an option for you, if you can work with real life coaches. If it's not, message us anyway. Give us the information. We will work on your behalf to build that relationship with your therapist to give you that opportunity. Listen, you're capable of incredible change, but it has to begin with you. Now, as always, my name is Marcus Moore. I want to thank you for taking the time this morning to listen to the Real Life Academy podcast. Make sure to subscribe to the podcast. Tell your friends about what we're doing to change the face of mental health. I'll see you on the next episode. And until then, stay in therapy and make the most out of your tomorrow. We'll see you then.